Hello and welcome. Today we'll be discussing hypospadias, a congenital condition affecting the male urethra. We'll explore what it is, what causes it, how it's diagnosed, and the available treatment options. The exact cause of hypospadias is often multifactorial and not fully understood. However, a combination of genetic and environmental factors are believed to play a role. This can involve disruptions in the hormones that stimulate the formation of the male genitalia during fetal development, particularly androgens. Certain maternal factors such as advanced maternal age, obesity, exposure to certain chemicals or pesticides during pregnancy, and fertility treatments may also increase the risk. In some cases, a genetic predisposition can be identified, with the condition running in families. In typical male development, the urethra forms as a tube along the underside of the penis, extending to the tip. In hypospadias, this process is disrupted, resulting in the urethral opening forming on the underside of the penis, rather than at the tip. This occurs because the urethral folds, which normally fuse to form the urethra, do not completely close. The severity of the condition depends on how far down the penis the opening is located. In mild cases, the opening is near the tip, while in more severe cases, it can be located further down, closer to the scrotum or perineum. The foreskin may also be incompletely formed on the underside of the penis. Hypospadias is a relatively common birth defect, affecting approximately 1 in every 200 to 300 newborn males. The incidence can vary slightly depending on geographical location and ethnicity. While it's generally considered a sporadic condition, meaning it occurs randomly, a family history of hypospadias can increase the risk. Studies are ongoing to better understand the overall prevalence and contributing factors. The most obvious sign of hypospadias is the abnormal location of the urethral opening on the underside of the penis. Other symptoms may include a hooded appearance of the foreskin, where the foreskin only covers the top of the penis, and curvature of the penis, also known as chordy, especially during erections. This curvature can make urination and sexual intercourse difficult in adulthood if left untreated. In severe cases, difficulty with urination, such as spraying instead of a straight stream, may also be present. Diagnosis of hypospadias is typically made during a physical examination of the newborn. The doctor will visually inspect the penis to identify the location of the urethral opening and assess the degree of penile curvature. In most cases, no further diagnostic testing is needed. However, if the hypospadias is severe or associated with other genital abnormalities, further investigation, such as an ultrasound to evaluate the internal reproductive organs, may be recommended to rule out other underlying conditions. Hypospadias can be classified based on the location of the urethral opening. Glandular hypospadias is the mildest form, with the opening near the tip of the penis. Penile hypospadias involves the opening being located along the shaft of the penis. Scrotal hypospadias occurs when the opening is at the junction of the penis and scrotum. And perineal hypospadias is the most severe form, with the opening located in the perineum, the area between the scrotum and the anus. These classifications help determine the complexity of surgical repair. The primary treatment for hypospadias is surgery to reposition the urethral opening to the tip of the penis, correct any penile curvature, and reconstruct the foreskin if necessary. Surgery is typically performed between 6 and 18 months of age. There are various surgical techniques available, and the choice depends on the severity of the hypospadias. The goal is to create a functional and cosmetically normal penis, allowing for normal urination and sexual function in the future. Post-operative care involves careful monitoring for infection and wound healing. Currently, there's no definitive way to prevent hypospadias. However, pregnant women can focus on maintaining a healthy lifestyle by avoiding exposure to potential environmental toxins, managing their weight, and discussing any concerns about fertility treatments with their healthcare provider. Further research is needed to better understand the contributing factors and develop potential preventative strategies. The prognosis for hypospadias is generally excellent, especially with surgical correction. Most boys who undergo surgery achieve normal urinary and sexual function. Long-term follow-up is important to monitor for any potential complications, such as urethral stricture or fistula formation. Research continues to focus on improving surgical techniques and understanding the genetic and environmental factors involved in hypospadias. Some studies are exploring the role of prenatal hormone exposure and genetic markers to identify individuals at higher risk.